All right, 2026, we've made it, but what does that mean for the Canadian healthcare system? In this video, we'll take a look at where we're at and where we're going, some of the things that we should keep on our horizon as we transition into the next year. Thanks so much for joining me. Let's start with the good things about Canadian healthcare. A 2025 survey by Abacus Data found that when they polled 1,500 Canadians, 68% of them said universal healthcare in Canada is a source of national pride. The survey also showed that nearly all Canadians, 89%, believe improving access to our universal health system should also be a key priority in building a stronger country. So that's the good news, is Canadians are proud of our healthcare system and we're motivated to continue to build it. One of the key measures for how well a healthcare system is doing is life expectancy. And Canadians are quite proud to point out that on average, we live 4 years longer than those in the United States. However, in comparison with other developed countries, Canada is actually somewhere in the middle of the pack. For example, if we were to compare ourselves with Japan, which has a life expectancy of 85.3 years, Canadians on average live about 3 years less than those in Japan. So it turns out we're willing to spend a lot of money on healthcare. In terms of Canada's gross domestic product, which is the sum of all the goods and services that are produced in Canada throughout a year, Canada spends 12.7% of that gross domestic product on healthcare spending. In real terms, this works out to $398.8 billion. That's a lot of money. If we break it down into the cost per person, Canadians are spending $9,626 per person on healthcare each year. Overall, Canada spends quite a bit on healthcare. We're ranked number 5 out of the countries that were surveyed in terms of healthcare spending. We do spend less than the United States. However, compared to Japan, we spend more, and we already saw that Japan has a higher life expectancy than Canada. So we might think about what sort of lessons we can learn from other countries in terms of improving the efficiency of our healthcare system. So given that Canada is spending so much money on its healthcare system, it makes sense that expectations for the delivery of the healthcare system would be high. Well, it turns out that in terms of satisfaction, only 50% of Canadians are actually satisfied with the current healthcare system. This highlights the need for reform. Now, one of the common criticisms of the Canadian healthcare system is that there's just not enough doctors to go around. And if we compare ourselves with other countries, we see that Canada is doing relatively poorly in terms of the number of doctors available. Now, the shortage is particularly acute with family doctors. It turns out that we only have 119 family doctors per 100,000 people in the population. This means that each family doctor is responsible for seeing 840 patients. That is an astounding number of patients, and it's not really realistic that they're going to be able to devote their full time and attention to each patient when they're given such a high patient caseload. Another common criticism of the Canadian healthcare system is a lack of access to hospital beds. Many Canadians will find themselves sitting out in the hallways at their local hospital simply because there's no place for them to go. In addition to that, there's a shortage of specialized equipment such as MRI machines, PET scans, and CT scans. This means that Canadians might end up in long wait lists in order to have imaging done, and in order to bypass the queue, a lot of Canadians feel like they need to go across the border to the United States and pay for service so that they can have quicker results. The fact is, if you have something like cancer, 3 months or 6 months can make a big difference in terms of survival outcomes. So you want to stay on top of it as quickly as possible. So it's essential that in Canada, we find a way to increase access to these imaging devices. All right, so we've talked about some of the perspectives and shortcomings about Canadian healthcare. Now let's talk about the plan. What is Canada doing to make its healthcare system better? Now, as you may know, Canada's healthcare system involves cooperation across federal and provincial levels. In this analysis, I'm going to start by talking about the federal healthcare plan because that's what's relevant to the provinces and territories across Canada. On November 4th, 2025, Mark Carney and his Liberal government unveiled Canada Strong Budget 2025, which was later passed in Parliament on November 17th, 2025. That foundational document would set and plan a motion for Canada over 2026 and into the future, including the healthcare plans. The document is nearly 500 pages, so maybe you haven't read it, and if you haven't, that's okay. That's what this video is for. I went through it and picked out some of the key things to pay attention to as it relates to healthcare spending. So the overall federal budget is $486.9 billion. In terms of our healthcare spending, we are spending approximately $70 billion. This means that about 15% of the federal budget is spent on healthcare. The spending for 2026 is divided into different categories. The first category is the Canada Health Transfer, which sits at $54.7 billion. This is the largest segment of funds that's dedicated to healthcare spending. Then we have our spending for our health agencies. Now, the two largest health agencies in Canada are the Department of Health and the Public Health Agency of Canada. The Department of Health is responsible for the general well-being of Canadians, and it includes programs such as expanded dental care and pharma. It also is responsible for reviewing and approving drugs and making sure that they are safe and effective. In addition to the Department of Health, we have the Public Health Agency of Canada. The Public Health Agency of Canada functions similarly to the CDC, or the Centers for Disease Control in the United States. Essentially, it's responsible for tracking the health across the population with epidemiological data and for ensuring that Canadians are protected against chronic and infectious diseases. So, for example, during the COVID-19 response, the Public Health Agency of Canada was very active in making sure that Canadians were well vaccinated. I should mention that a total of $1.4 billion was dedicated to the Canadian Institutes of Health Research, which helps to improve our understanding of healthcare problems and come up with solutions on how to fix them. In addition to that, some money is dedicated to Indigenous services because the federal government is responsible for the healthcare of the Indigenous people in Canada. It is a little bit more complicated, so I'm not going to get lost in the weeds there breaking that down. Now, one thing I want to highlight is that $5 billion have been set aside for improving Canada's healthcare infrastructure. This is across 3 years, so that means that essentially $1.5 billion, more or less, per year has been allocated. In real world terms, that might be hard to understand. What does that really mean? You and I might think about money in terms of the sandwich that we buy at the local coffee shop, or our car, or our house. In Canada, a house might cost $1 million, but what can you really buy with $1.5 billion? How many hospitals can you purchase? Now, I want to highlight two ambitions that are part of Canada's long-term healthcare plan. One of the things that Canadians might complain about is that our healthcare is universal, but it's limited in its scope. Yes, if you're sick and you go to a hospital, the hospital will take care of you. However, there are certain out-of-pocket expenditures that Canadians are responsible for paying for. In general, about 70% of healthcare expenses are covered by the government, but that means about 30% come from the public payment.
What do the experts say about this?
30% of the total health spending pie is paid for by private sources. Actually, that's higher than the OECD average. So Canada's a little bit higher on the spectrum in terms of its share of private funding. A couple of things. When we talk about what are the big ticket items in terms of private dollars, really what we're talking about here are prescribed drugs and spending on allied health professionals, for example, dental care and vision care. And a couple of the issues that we're monitoring in the future is, of course, implementation of some new policies, such as national pharmacare and the Canadian Dental Care Plan. 4 jurisdictions have signed on for national pharmacare. And the Canadian Dental Care Plan is targeted to people who don't have health insurance. So what we'll be looking for is possibly some things that are currently paid for out of pocket that could be then picked up by public pay.
Canada has a long-term ambition to roll out a pharmacare program and a dental care program to help address some of these coverage gaps. The fact is, in Canada, you may need to pay for prescription medicines and dental services, and there are some other sort of niche services like physiotherapy that are not covered. So far, Canada has committed to implementing a national pharmacare plan that covers diabetes medications and provides access to contraceptive care. Now, this agreement is negotiated with each of the provinces, and so far only 4 of the provinces have signed on to the accord: British Columbia, Manitoba, the Prince Edward Island, and Yukon Territory. This means that there are still the majority of provinces and territories that have not signed on to the plan, and this is something that needs to be addressed if we are truly to have rollout of nationwide pharmacare.
Progress has been slow, leading to frustrations.
We've asked the minister repeatedly, and they say they're committed to pharmacare, but there's still no action on any new deals. It's been months.
Now let's just hear some thoughts from the health minister on where things are at.
As you saw in the budget, we protected the pharmacare agreement that we have. And for now, I'm continuing conversation with provinces and territories on next step. So not for today, but I'm still continuing conversation. Some provinces and territories would like to see other coverage than diabetes or contraceptive. So as I said, I'm still having conversation with them.
Now, one thing that I should mention is that the pharmacare plan does not cover all of the diabetes medications. It tends to cover some of the older generic medications that are less expensive. Do they work? Yes. Are they the best medications on the market? Not necessarily, but of course, with any medication, it depends on the individual, and so medication plans should be individualized. I'm not going to say there's one medication that is inherently better than another. However, I just want to state that these are sort of covering the basics, but you're not going to get necessarily your designer brand drugs. Just a quick word about the Canadian dental program before we move on. Canada rolled out a dental program that would provide coverage to those who do not have access to dental insurance and who has a family income of less than $90,000. So a lot of people with higher incomes will not be eligible for the Canadian dental care plan. It's only those who demonstrate relative need given the fact that their family income is less than $90,000. Personally, I'd like to see everyone get access to the Canadian dental plan regardless of their household income. Yes, it might be more expensive, but you also bypass all of the administrative paperwork of verifying that the people applying to the program have an income of less than $90,000. All right, so now that we've covered the general status of the Canadian healthcare plan going into 2026, there are some things that we should mention, some possible headwinds or trends that could affect the rollout of the healthcare plan. Because it's one thing to have a plan, but it's another thing to deploy it in the real world. So here are some things that I think that we should have on our radar as we move into 2026. So the first thing I'd like to highlight is the ongoing tensions with the United States with regards to economic policies. A recent study conducted by the Canadian Medical Association revealed that nearly 90% of physicians are worried about how changes to cross-border trade will affect their patients. Physicians are concerned about the rising cost of living, the escalating cost of medications, and the potential shortages of medications. Right now, Canada takes 16% of our drug supply directly from the United States, but it goes far beyond just drug supply. We need to think about access to equipment and access to laboratory testing services. We also need to think about data security. The Canadian Medical Association is urging the federal government to continue to ensure pharmaceutical products and medical devices are not included in any countermeasures on tariffs, improve safeguards for Canadian health data, improve labor mobility so that physicians can work across the country, and to make it easier for qualified physicians to immigrate and work in Canada, including by fast-tracking immigration steps for US physicians. In addition to this immediate response, Canada should plan to increase self-sufficiency in domestic pharmaceutical and vaccine manufacturing through a vast direct investment strategy. Another thing that the Canadian Medical Association highlights is that beyond these considerations, US software companies dominate in our hospital sector, which is at risk of being subjected to foreign legislation, mandating the disclosure of Canadian health data in their possession. It is imperative, therefore, that health data confidentiality remains a priority with safeguards implemented to ensure its security. Canadian-based servers should be the norm when storing Canadians' health information, especially as the necessity for data sharing across our healthcare systems grow. Another trend that we should keep in mind is the rise of infectious diseases. I personally was quite surprised to learn that Canada lost its measles elimination status in the past year, and I'll probably make another video on this, diving deeper into it. But the point is that it's one thing to have an effective vaccine, and it's another thing to convince people to take it. So great steps will be needed in Canada to improve education around vaccines, to hopefully improve the uptake of vaccines, and in cases where vaccine uptake is poor, strategies to contain the spread of infectious diseases will be needed. Now, I touched on this before, but there needs to be improvements in how we handle our data across Canada. Many doctors in Canada are still sending faxes back and forth in 2026, which is, in my opinion, quite shocking. There needs to be better integration of data across different data collection centers, including down to the level of primary care, so that we have more granular understanding of how we're managing our chronic diseases, and so that we can have targeted healthcare policies that are able to act upstream before patients arrive in the hospital.
This does then mean thinking about spending or targeting our investments towards higher value care. Well, higher value care tends to occur more upstream in the system. It is things like primary care, community care, chronic disease management in the community. But here's the challenge though. Knowing we have to strengthen primary care, right, as a foundation for change, we need to invest in primary care data infrastructure because data is in fact weakest in this setting. It's like planning in the dark, right? Fragmented data sources, inability to benchmark effectively, inability to really measure quality or to link money to outcomes is really, really hard.
Ensuring that the data that we do collect is sovereign and secure is also a key consideration. Another trend that is going to play a key role in how Canada's healthcare rolls out is the demographic shift. There are two demographic shifts that I'd like to highlight here. Number one is the aging population. Of course, as people get older, this puts an increasing burden on the healthcare system as they tend to have more diseases and more healthcare problems in general, and this means that it costs more money to take care of them. Now, beyond the demographic shift with respect to age, we have the demographic shift with respect to immigration. In Canada, there has been a change in immigration policy to be more restrictive about immigration. This means that people who might be potentially students who could convert into doctors are not being let into the country with the same frequency, but it also means that there are less people who are seeking Canadian healthcare services in general.
Ottawa put a limit on foreign students in part to help ease the pressure on the cost of rental housing while trying to reduce the burden on hospitals and other public infrastructure and social services. Citizenship Canada says its aim is also to create a pipeline of international student graduates whose skills match the country's long-term economic and labor needs. Adding eligible fields include healthcare, social services, education, and the trades.
So it remains to be seen, I think, how that will play out in terms of the impact that that has on the Canadian healthcare system, but it's a story that I'd like to follow over the next year. Another debate, which is not new but remains very relevant, is the balance of private and public health care. Now, I'd like to highlight the perspective of two experts on the topic of private versus public health care, Dr. Nadim Esmail from the Fraser Institute and Dr. Danielle Martin. Both had some valuable contributions on this subject. Let's hear what they had to say.
The private sector is not an enemy of universal health care. The private sector is in fact a partner in getting a high-performing universal access healthcare system, a system we're already paying for.
Well, we're in agreement that we need better value for money. And what I would say is, as a person working in the healthcare system, I don't want to see more competition. I want to see more collaboration.
So where do I stand on this issue? I think that, to me personally, the thoughts of Dr. Danielle Martin resonated. I would really like the idea that we find a way to collaborate more as a healthcare system. This doesn't mean that there isn't a role for private spending, but I don't want Canada to go the route of the United States, because we've seen that overall the United States spends a lot more on their healthcare system than Canada does, and it doesn't seem to be delivering the same value that the Canadian healthcare system does, in the sense that our life expectancy, for example, is longer. Now, another thing that could shape the rollout of healthcare in 2026 in ways that we might not even be able to predict is the growing role of AI. Artificial intelligence is a key factor in data processing nowadays, and it could lead to new efficiencies in terms of lightening the burden on healthcare physicians and providing access to information. Of course, there are problems with artificial intelligence. Not all of the information produced by artificial intelligence is necessarily correct, and it's probably just a matter of time until we have a doctor ask an artificial intelligence for information on a given subject. The artificial intelligence gives an incorrect answer, and this results in a poor outcome for a patient. Now, hopefully that doesn't happen, but I can't rule out that it might at some point in the future. The other thing about artificial intelligence is the artificial intelligence is linked to some sort of data storage center somewhere. If we are using American software, this would link back to American servers. And so the question is, can Canada develop its own artificial intelligence drivers and domesticate that? And so I think there is a focus on this and an awareness of it, but it will take time to develop our own internal AI systems that are powerful enough to do the jobs that we need it to do, and still will help us to protect our patient data. So what are my final thoughts and conclusions? Overall, I think the Canadian healthcare system is something that we should be proud of, but there's definitely a need for reform in order to make it work better for Canadians. There's a lot of things to pay attention to over the next year, and I will be following those closely, and I hope you will join me on this channel as I continue to study the evolution of how things are going, with, of course, more of a focus on the pharmaceutical side of things, because this channel is named Pharma Talks. With that said, thank you so much for joining me today. I hope you enjoyed listening to some of the things that I've had to talk about, and I look forward to producing more content for you in the future. If you did enjoy the content, I would really appreciate if you could give me a like and a subscribe and help me to grow this channel. Thank you so much for your time, and looking forward to chatting with you on the next episode. Take care. Bye-bye.